and how I've used those skills now in my clinical practice, how it's improved my empathy. So kind of about that. And then, of course, I'll talk a little bit about organ donation, and then we should wrap it up. So it'll be very informal, and feel free to contact me after or ask me questions after. I'm very open. As far as disclosures go, I'm a physician executive at Equum. I'm also the medical director of Donor Network West. I do consulting work for Abbott and Paragonix, and I'm on the medical advisory board for these couple of companies. But none of these, like, there are no direct financial disclosures associated with this particular talk. The only disclosure that I tell people is like I am a transplant recipient, so I'm going to be very biased towards organ donation and transplantation. Kind of the beginning of my story starts back in November 2018. Me and Ambreen were actually doing she was a fellow at that time. I was a resident in emergency medicine. I had been applying to critical care fellowship. Uh, and when you're in residency, you apply to fellowship towards usually the last year of your training. So you still have like a year to complete, and usually by like mid-year, you know where you're gonna go. And so this is right around that time. The match for fellowship is, I think, end of November, beginning of December. Right around the same time I was applying, I really wanted to get into critical care. In fact, my favorite was always cardiac critical care. I had no medical problems. I mean, looking back at these pictures, I always remember I went out with one of my best friends. We had drinks because I was so excited because I had gotten into Mount Sinai's critical care program, which is it was a really big deal for me because I come from a background in emergency medicine. And just at that time, it had just been a fairly new field for emergency medicine physicians to go into an ABIM accredited fellowship. And so I felt like I was kind of the underdog. And I was really, really excited. It was such a great program. I was going to be in New York City. Basically, I was 30 years old. Everything was going well academically, socially, about to move to New York City, like the city of my dreams. And looking back, I did have some weird symptoms, but at that time, when you're 30, I've had rarely ever been to the doctor myself. But at that time, I remember I did have a cough that was kind of persistent, but it wasn't, sometimes you get sick and you have a persistent cough for like a few weeks after, and that's quite normal. Usually people say if you have a cough for more than 6 weeks, that means that you should probably get some, further workup done. But in this particular case, it hadn't been going on that long. The only other symptom I remember having, and again, hindsight is 2020, was I was just really tired all the time, and because I wasn't sleeping well. And looking back, I kept waking up at nights. Like we now know what was probably going on, but at that time, I was kind of like, I'm probably just anxious. And so it wasn't anything that was keeping me from going to work or going out with my friends, but I do remember the cough went on for a few weeks, then the fatigue started, and then towards Christmas, so December of 2018, a couple days before Christmas, I went to work. I was a resident in the ICU at that time at a hospital called Mercy, Philadelphia. And when I went in, I usually, when I would do night shifts or 24-hour call as a resident, like the way I would get my exercise was by like going up and down the stairs instead of using the elevator. And I remember that particular day was the first time where like I had to stop in the stairwell. And then there had been a code that night, and usually as the ER residents or the ICU residents, we are the ones that go to the codes at the community hospitals. And like I remember I was like trying to run and I couldn't, like it something was just off. And when I went home the next day, I mean, when I say I went from feeling kind of sick, kind of not too well, but like that day, I mean, the following day when I went home from a 24-hour shift, it was like 100 times worse. All the symptoms were a lot worse. I was very short of breath. I couldn't even walk. I mean, I was living in Philadelphia in a fairly small apartment, like 700 square feet, and I couldn't even get from my bedroom to the bathroom without like getting short of breath. And that was very new for me. Um, so, that night, I ended up going to the emergency department. Now, keep in mind, I had just done a shift the day before. I saw my colleagues, and um, there were a couple of residents that had been sick with pneumonia. So we thought maybe I have pneumonia or flu or something. And I got into the stretcher in the emergency room. I remember, they were trying to do a workup. Again, everybody thought I looked sick. I remember the one thing was oxygen levels were low 90s, and I was like breathing really fast, which is never a good sign. And it's weird because I'm an ER doctor by training, and those are the two things that are very obviously like something is probably going to happen if you're like that. But I remember I wanted to go home, and I even remember I wanted to sign out against medical advice because I had a shift the next day. And of course, as a resident, that's all you're thinking about is like you don't want to burden anybody to do your shift. But I ended up staying because my attending had really, he was like, no, something is wrong. Like we got to figure it out. They had ordered some labs, some tests, and they got a chest X-ray. Chest X-ray showed, what we call like what we thought was pleural effusion. So it could have been honestly anything. It could have been a pneumonia, could have been heart failure, could have been nothing, but something. But it was all new. So we knew it was probably something. And someone who's 30 who's never had any medical problems, probably pneumonia was what we were thinking. I got some fluids, I got some antibiotics. They took me upstairs. And honestly, now that I focused in cardiac ICU in my training, like this exact presentation I've seen so many times, but it was very classic presentation of like acute heart failure. That night, I ended up the one thing I remember, I got to the floor and I remember looking up at my monitor and my heart rate was already in the 30s. And I remember I had been really tachycardic. My heart rate was like over 120 when I first got to the ER. And my heart rate was going down. I got really, really sweaty. And that's the last thing I remember from that night. Um, when people ask me, like, I remember a bunch of people were coming into the room. They had called a rapid response. Apparently, at some point they documented a PEA arrest. So they do think that I lost pulses. Now that I've trained in critical care, I'm like, I don't know. I probably didn't lose pulses. My MAP was probably like low and they couldn't feel it, but that's just the ICU doctor and me thinking about that. So I ended up getting resuscitated. I got intubated. I went to the ICU and I don't remember like the next 24 hours or so. So the only thing I remember so I felt like that happened and then I opened my eyes and there I was. I was in the ICU and there was a bunch of people around me. Um, the cardiologist that had been on call that night happened to be an interventional cardiologist. And so they had taken me to the cath lab and, eventually had diagnosed me with heart failure. Why? Eventually, I found out that it was a genetic mutation called a desmoplakin gene mutation causing familial dilated cardiomyopathy. But at that time, we were really unsure. We thought maybe it was a virus, maybe it was something else. Um, so that happened to me, and I remember the cardiologist had told me we got to take you somewhere with advanced heart failure capabilities. And I remember, like, I was a doctor, like I I couldn't even fathom like what I was like CHF, like just give me like I just need Lasix and I can go home. I don't think I fully understood the gravity of my situation in those minutes. Um, I eventually got transferred to University of Pennsylvania, and I was so sick by then that I got listed at that time the UNOS allocation system, so like the system that tells us, who gets transplanted, what the list is. The allocation system had just changed. And so, given how sick I was and my blood type, all the things, and I think I was one of the first people at that hospital to use this new allocation system. They told me the only thing that could help me at that time was a heart transplant. When people ask me, like, how did you feel? I don't think I even had time to think about how I felt. It was kind of like, you need a heart transplant and we listed you. And within 2 weeks, I got a heart transplant. So I went from a completely normal, healthy 30-year-old, finishing up residency to a very critical diagnosis to transplant and discharged home in less than 4 weeks of my life. It was craziness. It was I didn't even know how to deal with it at that time. I remember people were like, "Oh, like, you have chronic illness now." I was like, "Oh, I don't have chronic illness. I'm fine." Like I was running last month and I'm able to run again. Like I didn't even I couldn't fathom the what was going on with me at that time. But I got the transplant, I got discharged, I eventually went home. I did have a couple complications here and there. Like I did have an acute rejection episode, which means that I had to get medications at home, so they had to put a PICC line in me. And there I think I was like trying to study for boards or like my shelf exam or whatever, the ITE exam at that time. I had a lot of energy, and at first I thought maybe I just got like an athlete's heart, but as it turns out, they give you a lot of steroids when you get a transplant. So I think it was just the steroids kind of making me a little bit manic. I felt great, given the circumstances of what could have been. I was very thankful for the situation that was granted to me. Afterwards, I started doing some advocacy work. Volunteered for American Heart Association in Philadelphia. I did some stuff with Gift of Life. I was able to finish my residency. I did advocacy work as far as going to different um, medical conventions and doing lectures about my story. And that's kind of the journey that I decided to take with this, very crazy thing that happened to me. The most ironic accomplishment, this is me graduating with my critical care medicine. It was a 2-year multidisciplinary fellowship in critical care with a focus in cardiac ICU. And so this was me 2 years after my heart transplant, graduating from the cardiac ICU. And I thought that was an amazing accomplishment. Looking back, people always ask me like, how did you want to go back? Didn't you just, and I was like, I told myself I would at least try. I didn't know COVID was about to happen. I told myself that I would at least try. If I didn't feel like I could finish, then at least I would not regret having tried. And so I tried and I tried and I ended up finishing. I did have to take some time off because I had AVN from the cardiac transplant medications, which means I had to get my hips replaced during fellowship, but that's like a whole other lecture to do. I was able to meet my donor's family. It's kind of a complicated story of how some people are able to meet the family of their organ donors, some people aren't, but all it comes down to is like whether or not there's consent on both ends of both parties. So I was able to meet them. I found out that my donor had been a woman in her early 20s named Lucy, and she had a sudden brain cyst rupture, and so it had caused her to be brain dead. And she had already told her family about her decision to, want to be an organ donor, had if it ever came down to it. Her family happened to have a relative who either needed a transplant or had a transplant, so they kind of knew a little bit about it. And so there was no question, she became an organ donor. It wasn't just me whose life she saved. She actually went on to save 4 people total through both kidneys, liver, and heart transplantation. She was a respiratory therapy student, and she'd always wanted to work in an ICU, which is probably the most, I like to call it like tragically serendipitous part of the whole story. We were interconnected in so many ways, and I was able to continue her legacy as a person, but also the things that she wanted to do. I happen to also want to do. Until this day, I'm very close with her family. They've been to California once. We have been to they live in upstate New York, so we've been there as well, and it's just an amazing way to give back to not only the community but also her family by sharing my story and doing all the advocacy work that I can. I was able to embrace this transplant. I think Rock Hudson in the 80s, when he was first diagnosed with AIDS, at first he was not very open about it. And I think he said something along the lines of like, let me make this, tragedy into something good for the future of humanity. And that's why he like disclosed that he had HIV and eventually AIDS. So I kind of embraced it the same exact way. Let me make the most of what happened to me. There's only so much dwelling and anger and sadness that I could have about the situation. But I tried to at least look at it. And I don't want to say positive because I feel like when I say I'm a positive person, that really downplays how difficult it's been being a transplant recipient. But I can't constantly complain and being angry at the situation. Why didn't I get diagnosed with this years ago? A lot of people, especially cardiologists, will ask me things like, what if you had gotten an echo 5 years prior? Would that have changed anything? Actually, it probably wouldn't have, because these things are really difficult to tell what the phenotype is going to be. If somebody has this specific genotype, it's really hard to figure out how to surveil things like this. And honestly, like that's not going to change. Like, what's that going to do? Just make me angry or regret not getting an echo earlier? So I don't even think about that. I did start this blog called A Change of Heart. This was started on post-op day 7, and I still have the initial blog post where I was like, I'm in the, post-op cardiac unit, and I didn't think it would take off. I honestly initially made it just because I was so sick of like constantly telling people I was fine. I was like, I'm just gonna put everything on this blog. You guys can have this link. And then I eventually made this Instagram for it, and I've just done a lot of education advocacy work through it. I also started, I was thinking of other things that I really wanted to do. I wrote this while I was recovering. I took about 6 months off. And of course, this is like super resident of me, but I was like, I can't just like sit around and relax. I have to do something. And I remembered as an ER doc, like, the easiest patients to disposition in the emergency department are transplant patients. All you got to do is like get some labs and admit them. So I remember not really knowing how to take care of a transplant recipient. And so I wrote this paper, and these names, I don't know if you guys know these names, but they're really big names in emergency medicine. It was kind of an honor for me to be able to do this paper with these guys who were like mentors to me. And this got published in AGEM, and it was so awesome because I helped do this review, and it helped my own colleagues, and it was great. I did some advocacy work, and my main teaching points that I'll end with is that, I learned how to empathize with my patients and their families. I tell people that support groups are key. So as a physician, one thing that is important for me, I remember when I first got my transplant, people had told me, like, I think Penn had given me like a support group, and I went, and it was like me and a bunch of like old men, which is like totally fine, but like that's the most demographic of patients with heart failure who are going to go to an in-person group meeting is going to be that. And like I had nothing in common with them. I remember the questions that they were asking were things like, they want to see their grandkids. And here I was trying to like live my life as a 30-year-old. So I do mention this to a lot of physicians and healthcare workers in general is like, make sure when you're giving these support groups to your patients, it's important for them to follow up with, peers that they can actually engage with and have commonalities with. And that was really important for me. I just used Instagram. I just Googled like women with heart transplant, and I met this amazing group of people that way. And another thing that I tell people is to communicate clearly with their specialist teams. I ended up, finishing my fellowship in critical care. I still do a little bit of critical care, through telemedicine, but I ended up becoming a medical director at an organ procurement organization. So it's been really awesome. As you guys know, when patients are in the ICU, if they die, most likely that patient is in the ICU. So all organ donors come from ICU settings, and so about 7% of the critical care curriculum is focused on organ donation, organ donor management. So it's been great trying to give back to the organ donation community, being involved not only on the education aspect, but writing policies and helping with clinical guidelines of these organ donors in California. And I also like to always mention that it's important to register as an organ donor. And if you're not going to register, I say to at least tell your families what your wishes are, whether you are or you aren't. It's important because we're the ones as the OPO who go in and talk to these families, and it's so nice when families know what their loved one would have wanted. One interesting fact is, you are more likely to need an organ transplant than actually become an organ donor. People are very surprised to hear that. The last study that was done on this was a little over 10 years ago, and it was mostly with brain dead patients or donors. And right now we are doing something called donation after circulatory uh, arrest, and which is DCD basically. So this doesn't include DCD, but as far as DBD goes, there's like a less than 2% chance that you're ever actually going to die in a way that would allow for organ donation. So even if you are an organ donor or registered as an organ donor, you're most likely not going to be able to donate your organs. And most people don't know that. You're actually more likely to require a transplant in your life. And the last thing I wanted to say is, thank you so much for all that you do. It's really important for me to get this message out. I don't try to just be like an inspirational story. I think this just humanizes medicine in a way that some of us sometimes need to hear to remember how important our jobs really are. And so I always like to end with that. And if you guys have any questions, this is the best way to contact me.
Alin, that was beautiful. I've heard the story many times, and just like Alin said, I was a cardiology fellow when she was an ED resident. And even before she had this whole event, we didn't know each other that well, but I'm pretty sure we shared some great phone calls between the ED and cardiology when trying to admit patients and probably fighting and all of that kind of stuff. And then I remember this happening, and I remember the blog because that's how I first found out how everything happened. And I was just so hooked. I kept reaching out to her, and I felt like such a pull to just be like, anything that I could do to like help you or just be there for you or support you. And we've kind of been in touch ever since, and have really supported each other through, career changes and things like that. So thank you again. You're such a kind soul. And she also has a podcast, by the way. What is it called? Beyond the Stethoscope.
It's both sides of the stethoscope.
Both sides of stethoscopes. I can't even say it right.
It's really hard to say. I can never say it. Both sides of the stethoscope, and it's actually really cool. I don't have that in here just because we're working on our new season, so it's like, I mean, you can check it out, but there's gonna be new episodes starting in a couple months. But I actually have this podcast with a cardiologist with a heart transplant. So, and he's had hokum since he was a kid, and so he has a very different perspective. He had cardiomyopathy, but when he was diagnosed, he was like 10. And so, he went into medicine because of his transplant story. He's a cardiologist now because of it. He's actually finishing his advanced heart failure fellowship right now. So, and then for me, like, it was just this sudden thing that happened to me. And so we both have very different perspectives, which a lot of people don't realize. Like, acute heart failure is very different from chronic heart failure, pediatric to adult transition, getting one as an adult, very different thing. So we bring in perspectives of what it's like being on both sides.
Awesome. Does anyone have any questions that they want to ask her before we have to let her go? We have like 5 minutes for questions. Nobody? Come on, guys.
Alina, I've got a question. First of all, thank you. That was like amazing and inspirational, and really, really appreciate you sharing your journey. I'd love to hear your thoughts on like what the biggest opportunities in the transplant space are right now. I mean, you're really on the front lines of advocacy and also the care space, and you've seen it from the patient perspective. Like where is this field going to improve, and where can it improve in the next few years?
It's becoming a very hot topic with DCD and DBD transplantation. Just less than a year ago, Jacob Schroeder at Duke published that they were the first center that ever started doing DCD hearts. DCD hearts are really they're really game changing at this point because up until a couple of years ago, only brain dead donors were allowed to donate their hearts because that means the heart has to stop and then restarted and placed into someone else. So I think a lot lot of innovation is going into procurement strategies, DCD transplantation, and uh, a lot of transport devices. So like Paragonics, as an example, is one of the companies that I do consulting for. So I think just overall, the field of organ donation, organ procurement is really, really changing. And I only think it's again, I'm biased. That's why I tell people I'm a recipient. I think it's going in the right direction. There are over 103,000 people waiting for organ transplants right now, mostly, but 85% of those are waiting for kidneys, but a good chunk hearts, livers, not as many intestines nowadays, but kidney, heart, liver, lungs, very, very important. So I think all of these different things that are going on in the next 10 years are just gonna improve organ procurement and eventually more people are going to be able to get transplants. That and then another big part that I tell people is patient advocacy in general. You're seeing more and more companies and organizations really bring in the patient voice, which is important. I mean, again, I've been on both sides. Very important space to get into. Having the voice of and again, not just the transplant recipient, but the donor family. They are a big part of transplantation. So the donor family, the living donor, the transplant recipient, getting their voice on some things. Has also been a big thing that's going on. So those are probably my two guesses.
Thank you for that, Alin. There's another question by Jillian, and she's asking, you had to wait around 2 weeks to get your heart transplant. What is like the average wait time now to get a transplant, especially since, it's changed their whole determining who's urgent, non-urgent?
Yeah, that's a really good question. It's also really hard to answer. So it depends. The latest allocation guidelines that changed in 2000, again, right at 2018, 2019, kind of made it easier for patients who are urgently waiting to get it. So they get it a little bit faster than before. But also what that means is people are living with LVADs for years, like 10, 20 years now because they're stable. And so people are trying to really find that sweet spot. It depends on what your status is. It depends on your blood type. So it's really hard to answer. I would say from all the patients that I've taken care of who are waiting for transplant, all the sequences that I have to go through when I'm on call for organ donation, I would say 2 weeks I've rarely seen. So it's probably a little bit longer than that, but again, it really depends on how sick the patient is.
Anyone else have any questions? Yeah, I still remember like back in the day, like when I was in residency, they would have patients in the ICU for months
Yeah,
waiting, right? Like on inotropes, and how much that has changed. This is
yeah.
like how dated I am, but yeah, I still remember that, and that's just so different now. They just don't have that anymore.
And that's what like Kobe and I always talk about like on the podcast because he had to wait in the pediatric cardiac, I think somewhere in Boston, pediatric cardiac unit for 6 months. And I think he was like 19 or 20 at that time. And so, first of all, he was like the youngest person there, which was difficult. And then on top of that, he was trying to transition from peds to adult, which is also that, a growing field. And then on top of that, like he always says, he's like, all he wanted to do was shower. Like in those 6 months, like that's all he really thought about was just being able to shower. And so, yeah, I don't think people wait in hospitals anymore because they're able to go home with PICC lines and inotropes, and and then balloon pumps are now like placed axillary, so they don't have to like wait and like they walk around with balloon pumps. So things are really changing. I would say if somebody's super sick, they usually probably get one within 2 to 4 weeks, but again, depends on so many things.
All right, girl. Well, we are right at time. Thank you so much again. I'm sure
Having
everybody
me.
loved this. So many people are just saying it was such a wonderful and inspiring story. And this is recorded, and so we're going to put it up on our YouTube channel and share it on our socials. So I'll send it to you too, so you can share it as well.
Perfect. Thanks, guys. Have a
All
good
right,
day.
awesome. Thanks. Bye.
Thank you.